الرجيم بسم الله الرحمن الرحيم والصلاة والسلام على أشرف الأنبياء والمرسلين سيدنا ونبينا محمد وعلى آله وصحبه وسلم تسليما كثيرا. أما بعد, we welcome you to this important seminar on the role of social media in influencing the role of youth and adolescent health. Before we go into the program, we are going to listen to a recitation from the Quran. And I would like to invite our brother Mu'tasim Hassan Muhammad to read some verses from the Quran.
أعوذ بالله من الشيطان الرجيم. إن الذين آمنوا وعملوا الصالحات كانت لهم جنات الفردوس نزلا خالدين فيها لا يبغون عنها حولا. قل لو كان البحر مدادا لكلمات ربي لنفد البحر قبل أن تنفد كلمات ربي ولو جئنا بمثله مددا. قل إنما أنا بشر مثلكم يوحى إلي أنما إلهكم إله واحد. فمن كان يرجو لقاء ربه فليعمل عملا صالحا ولا يشرك بعبادة ربه أحدا.
Jazakumullahu khair. Thank you very much, Brother Muhammad Mu'tasim, for this beautiful recitation of the Quran. Ladies and gentlemen, the Vice President, Sector Operations, Dr. Mansour Mukhtar, the Assistant Secretary General of the Islamic Organization of Islamic Cooperation, Ambassador Muhammad Naim Khan, our distinguished guests and delegates, welcome to the seminar on the role of social media in influencing the role of youth and adolescent health. At this critical juncture, I couldn't honestly think of a much better topic to discuss when it comes to the issue of the youth. Because if you look at the statistics globally, every second there are 12 new active mobile members. Almost 1 million per day are added as of 2015. Among the 2.5 billion internet users, about 2.3 of them are already on social media. And what is interesting, especially for IDB member countries, is that more than a quarter of the world's mobile users are in East Asia and South Asia. So this is really an interesting topic, which inshallah is going to be deliberated upon. Some housekeeping rules before we go into the program and the speeches. Please, if your mobile phone is with you, kindly put it on silence mode. This activity is on social media, so we are going to be actively utilizing the social media. There is a hashtag. Some cards have already been distributed with the hashtag, which is hashtag ISDV42AM. So please, while the event is taking place, try and share your thoughts and what the speakers are saying on the social media. Without wasting much time, I would like to invite the Vice President, Sector Operations, Dr. Mansour Mukhtar, to give his opening remarks.
Bismillahirrahmanirrahim. Assalamu alaikum and good morning to you, distinguished ladies and gentlemen. It is my great pleasure to welcome you all to this 42nd IDB annual meeting and this particular seminar on a topical issue themed effect of social media on the health of youth and adolescents. I'm pleased to note that we have a wide range of experts and stakeholders here today. And I welcome our guests from the OIC member countries, from the Kingdom of Saudi Arabia, Turkey, and Indonesia. Most importantly, I would like to welcome the youth, that some of whom are with us here today, but a large number, I guess, will be linking up via social media, and you are really the chief guests and chief beneficiaries of this event. Dear participants, this event culminates from the OIC initiative to explore and understand the increasing pattern of technology addiction and link to it the role of social media in member states. This initiative is very timely and commendable, and I hope that today's event will be very useful in furthering the discussions on this issue, on this particular and very topical subject. Dear guests, the social networking platforms such as Facebook, Twitter, Snapchat, WhatsApp, MySpace, among others, and countless others have become universal and ubiquitous. The advancement in access to internet, which we have just been alluded to by the MC, has greatly enhanced the access of all segments of the population to these new ways of communication and interaction. This new digital landscape has significantly redefined the social interaction space as well as flow and spread of information. This advancement, of course, has come with its own pros and cons. The research has demonstrated that extensive engagement with the social media can have tremendous effects, in particular on the physical and mental health of youth and adolescents. It can change their behavior, it can change their outlook, it can change their ideas and the mental health. Just to cite an example, one of the studies identified that the health impact of social media on children and young people was greatest on mental health, and specifically in the areas of self-esteem and well-being. The issues around cyberbullying and depression were deemed as most critical. This certainly is very worrisome for the development of our youth. Dear guests, the experience of member countries that have considered the subject, particularly Indonesia, Saudi Arabia, and Turkey, can certainly shed more light on the social media effect and trend in these countries. I also hope that they would share their experiences on how to turn these negatives into positives. And I hope that sharing of these experiences will guide the seminar towards expected outcomes, including knowledge sharing, generation of recommendations for IDB and OIC member countries, all with a view to paving the way for strategies to maximize benefits and mitigate the negative effects of social media. In closing, let me wish you very successful deliberations during this event. Thank you.
Thank you very much, Vice President. We do look forward to the deliberations. Now I would like to invite the Assistant Secretary General of the OIC, Ambassador Muhammad Naim Khan, for his opening remarks.
Bismillahirrahmanirrahim. Nahmadu wa nusalli ala Rasulil Kareem wa alihi wa sahbihi ajmain. Excellency, the Vice President of the IDB Group, distinguished speakers and panelists, dear guests, ladies and gentlemen, Assalamu alaikum. It gives me great pleasure to speak at this opening session of this seminar on the role of social media in influencing the health of youth and adolescents. At the outset, I would like to thank the IDB Group for having chosen to deliberate on such an important topic of our time. I am hopeful that the participants will be able to work out a strategy on how to address the emerging challenges related to the use of social media. It is widely believed that the young population is the backbone of any society. Young population is one of the key drivers of socio-economic development. The Muslim world is no exception, as the youth constitute a significant percentage of its population. Statistics show that the share of young population between the age of 0 to 24 corresponded to nearly 53% of the total OIC population in 2013, the highest ratio compared to the non-OIC developing countries, and the world at large. With these statistics in mind, all efforts geared towards improving any aspect of the welfare of our young ones are most opportune. It is in this context that the impact of the rapid advancement in information and telecommunication technology in the 21st century needs to be scrutinized with a view to forestalling potential health hazards that it might cause, particularly to the youth and adolescents. Dear brothers, ladies and gentlemen, one cannot deny the great opportunities that new technology tools such as internet, smartphones, tablets offer to the youth and the public in general. Access to the internet is now being considered as a basic human right according to the United Nations Human Rights Council, which passed a non-binding resolution to this effect last June. In the UN's 2030 Agenda, internet access is outlined as one of the core accelerators of development. Unfortunately, however, internet coverage in many of the OIC member states, especially in sub-Saharan Africa, is still low. Statistics shows that internet coverage in more than 20 OIC member states is less than 20%, meaning that a sizable number of the population has no access to the internet and hence being denied the great opportunities that come with this wonderful invention of our time. These include opportunities for learning, communicating, entertainment, and skill growth. Through social media, youth and adolescents can conveniently access online information about their health concerns. Fairly good health resources are increasingly available to youth on a variety of topics of interest to this segment of the population, such as sexually transmitted infections, stress reductions, and signs of depression. Adolescents with chronic illnesses can access websites through which they can develop supportive networks of people with similar conditions. The use of social media sites such as Facebook, Twitter, YouTube, Instagram, and others offer a unique opportunity for networking with friends and making new friends. With about 2 billion active users per month on Facebook alone, 2 billion active users per month on Facebook alone, social media can serve a great platform for sensitization of the youth on a range of issues, including those related to public health. The mobile technologies that young people use daily, namely cell phones, instant messaging, and text messaging, can greatly improve their health care, such as better disease understanding. Given that the new social media venues all have mobile applications, young people will have enhanced opportunities to learn about their health issues and communicate with their doctors. Despite these benefits, however, it would be a mistake to ignore the risk associated with using social media. One of the biggest risks in this regard is technology addiction, to which my distinguished colleagues mentioned, which is defined as the habitual compulsion to engage in using technology instead of addressing life's problems. Some researchers have associated the excessive use of these new technology tools with addiction, since many of the behaviors resemble the behavior associated with drug and alcohol. In OIC countries, few studies exist regarding youth addiction and technology, but these existing studies shed some light on the issue. It was against this backdrop that the OIC General Secretariat took the initiative to bring up this matter during the 5th Islamic Conference of Health Ministers held in Istanbul, Turkey in November 2015 as one of the topics during the panel discussion. This was in line with the objectives as stipulated in the OIC Strategic Health Program of Action under Thematic Area 2 on Disease Prevention and Control, where it is stated that community awareness activities within the prevention strategies are to be reinforced and designed to promote healthy life among the youth. Therefore, parents and teachers should be aware of any sign or symptoms of psychopathologies and shouldn't be reluctant to get help from mental health professionals. Moreover, children and adolescents should be taught to use the social media with time limit and responsibility. The panel discussion that I am referring to, which was held on the margins of the OIC summit in Istanbul, concluded that a common prevention program to eradicate this behavioral disorder is significantly essential and required to address health concerns of technology addiction in many OIC countries. It was further pointed out that the challenge posed by these new technology tools for OIC countries lays in ensuring that youth are using these new technology tools responsibly and productively. This requires educational leaders and parents to consider the potential use and potential abuse of the new technology tools and provide a well-defined structure for the adoption of technology by the OIC youth that will result in healthy technology-related habits. We in the OIC are therefore delighted that IDB Group, through organizing this seminar, is contributing to this important debate, and we hope that the outcome of this seminar will be widely shared among the stakeholders. We would suggest sharing recommendations of this seminar with the sixth session of the Islamic Conference of Health Ministers, which is scheduled to be held in Jeddah in the Kingdom of Saudi Arabia from 5 to 7 December 2017. The OIC remains committed to working with all the stakeholders in ensuring a healthy lifestyle of our youth in accordance with the tenets and teachings of Islam and in line with the objectives of the OIC as stipulated in its charter, OIC 2025 Program of Action, and the OIC Strategic Health Program of Action. With these few words, let me once again express our sincere thanks and gratitude to the organizers of this seminar and wish you fruitful and productive deliberations. Thank you very much. Wassalamu alaikum wa rahmatullah.
Thank you very much, Ambassador Muhammad Naim Khan, for this beautiful presentation, rich in data and rich in statistics, and I'm sure it will provide a lot of food for thought when we go into the deliberations. Now I would like to invite the moderator and the organizer and the man who has been working hard behind the scene to make this event a reality, Dr. Bashir Salam, to make his remarks.
Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Thank you, Excellencies, the Vice President and the Assistant Secretary General OIC for this deliberation. I will just invite you to a very short introductory video, which is part of the Global Economic Forum, to see, because the issue of social media was among the agenda. May you please show the video? Thank you very much. Actually, this is just to pave the way or to brainstorm us on the issues which we are going to have enough deliberation from the 5 speakers to this seminar. So we can step to our technical session. Thank you.
Thank you very much, Dr. Bashir Salam, for this enlightening video. So now we are going to go through the technical presentations and by each of the invited guests. The first one is going to come from the HDE, which is the health department here, and the HLT. And the theme of the presentation is Global Risks and Opportunities, Effect of the Social Media on the Health of Youth Adolescents. It's over to you, Dr. Bashir Salam.
start the presentation. Okay. Assalamu alaikum warahmatullahi ta'ala wa barakatuh. This is going to be the sequence of my presentation, which will start with media mania. Actually, it is not. It is a righteous misnomer, media mania, by virtue of the global use and misuse of the media itself. So this is just to show you something from the social media, telling how deleterious it is. So a blind is guiding somebody who is texting. So let me help you to cross the road. And we all, from this, we can imagine how it is becoming a true mania, to the extent that blinds can guide those who are really blurred by using the social media. As you have already known, that teens or people who are among the below the adolescents and up to 19 or 20 years are mostly everywhere in the world are online, at least as have been shown by the statistics, 6 to 8 hours a day. And the risk is an integral part of our daily life. No house in every corner of the world that doesn't have at least one or two mobile phones, and which is really engaging in one or using one of the social media. To this extent, the American Society of Sociology has adopted a new name or a new subspecialty in its profile, which is part of the psychology affected people, which is the media addiction to social media. This is again a small shot which tells a baby whose mother and father, instead of carrying him, they are just texting. So he said, "I think I was being born, but I was not being born, but downloaded." This is a real show from a hospital in one of our member countries. Visitors are putting the patient in a bench while they are occupying his bed, and what are they doing? They are just texting. This all shows the effect of social media and how it's becoming a mania, actually, rather than something which is blessing. The global picture showed that there are positive aspects of social media, including connecting kids and youth with friends and families, helping students with school, entertainment, and healthy advertisement on awareness raising on various issues. But there are some risks which are really influencing the behavior, outlook, and idea of the users, and in particular the youth. These include, as His Excellency the Vice President has mentioned, first the mental health, and then they have introduced something which is really new in the literature, which is called cyberbullying, texting, sexting, danger of sexual solicitation, exposure to problematic and illegal content, and privacy violations. The teens most at risk, often they adopt risky behavior in their daily life. When we come to phenomenalize cyberbullying, we just know that this is hard. It is the act of harnessing somebody online by sending or posting messages, usually anonymously, without knowing who has sent this to your mobile or to your box. So cyberbullying is bullying that takes place using electronic technology, telephone, internet, whatever. So it happens continuously, 24 hours, 7 days, 360 days a year, and it is without knowing who has sent it, or it is really very difficult in the internet to take it back out from your, after it has been launched, and because of that, actually, it is difficult to delete from our systems. So answering a text this is the other aspect, the road traffic accidents. And really, in Saudi Arabia, we really feel this, that texting while driving is really a big problem which leads to lots of accidents. So the scientists give us the fact that using texting, it takes you about 5 seconds. This is really, if you are driving at 55 miles an hour, this is enough time to cross a football field. So texting while driving causes an increase of 400% in time spent with eyes off the road, which is really time optimum to have an accident and to have very deleterious effects. Or 94% of the drivers support, this is one of the research results being conducted in USA, 94% of the drivers are supporting to ban texting during driving, and 74% of the drivers support a ban on handheld. And this is really a good sign that now in Saudi Arabia, we have come to monitor to see that the traffic police is monitoring closely these aspects, and they are putting heavy fines on the people. In fact, based on the research in USA also, that approximately 660,000 drivers are attempting to use their phones while behind the wheel. And the National Safety Council reports that cell phones used while driving leads to 1.6 million crashes every year, which is really quite considerable. And nearly 330,000 injuries occur each year, and out of every 4 car accidents in the United States is because of texting during driving. 11 teens die every day as a result of texting while driving. And according to a poll made at USA, that 94% of the teen drivers acknowledge the dangers of texting and driving, but 35% admit to doing it despite this knowledge. And 21% of the teen drivers involved in fatal accidents were distracted by their cell phones while driving. Teen drivers also are 4 times more likely than adults to get into car crashes or near crashes when talking or texting on cell phone. Again, the U.S. National Survey on Distracted Driving Attitudes and Behavior reports that nearly 0.5%, that is specifically 48% of all drivers admit to answering their cell phones while driving, and of those who answer their cell phones while driving, 58% of them continue to drive while taking or talking to the phone. In the survey, 24% of the drivers reported that they are willing to make a phone call while driving. This is insistence, this perseverance, that people, they do insist that they have to do it despite the fact that they know the danger. 1 in 10 drivers survey said that at least sometimes they send text messages or even emails while driving. Again, this survey shows that nearly that texting pedestrians, and pedestrians who are the people who are crossing the road on foot. There always researchers said that from the University of Washington monitor 20% of cities business intersections and observe the following: that pedestrians who text are 4 times less likely to look before crossing, because we are normally supposed to look to right and left before make the cross, but majority of these people, they are just blind by the fact that they are doing the texting and they don't pay attention, and that is the cause of lots of problems. They all found that texting pedestrians take an average of 2 seconds longer to cross the street. And in these 2 seconds, if you just cross between the yellow to red, then you are done with. Here, this is a simple message for the youth who are really very happy using this media. We, people at our generation, we just say that we are neither jealous nor envious. We are just judging what you are doing, and it's a kind of variation of thinking, and we are empathetic. To this, as one of the famous Hollywood actors and film writers, he said, we believe that empathy is the most essential quality of civilization. I will conclude with the ayah from Quran which says, وكذلك جعلناكم أمة وسطا لتكونوا شهداء على الناس ويكون الرسول عليكم شهيدا. And this is exactly which has been stated by Aristotle about 2,500 years ago. He said, aurea mediocritas. And this is a terminology very much in philosophy, which means and really representing our case in the Muslim Ummah. الوسطية or خير الأمور أوسطها. That desirable is the middle between two. We are here, we look to at least come to recommendations which will advise our institutions and our countries in the Muslim Ummah to be at wasat, الوسطية, mediocrity, not to do so much or less than what people, and in other words, we are looking forward for the benefits of social media and to adopt a beneficial sides of it. Thank you very much.
Thank you very much, Dr. Bashir, for this important and interesting presentation. Do not forget, please, this event is being shown live, and there is a social media hashtag, so please send tweets using the hashtag ISDB42AM. It's there. There are cards that have already been distributed, so please utilize the opportunity to send across messages, photos about this event. The next speaker is Mr. Haikal Atiq Zamzami, who is the chairman of the Students Research Center in Ibnu East Java region, I believe, in Indonesia. And he's going to talk about technology addiction, the experience of NU East Java, Indonesia, results of the research on technology addiction. And I think this will be an interesting presentation. Please, Mr. Haikal Atiq Zamzami, welcome.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillahilladzi wafaqal khairat ibadihi al-abrar. Ahmaduhu subhanahu wa ta'ala hamdan yudafi 'anil asrar. Asyhadu an la ilaha illallah al-fattahul jabbar. Wa asyhadu anna sayyidana Muhammadan abduhu wa rasuluhu al-mustafar muhtar. Wa usalli wa usallimu ala sayyidina Muhammadin wa ala alihi wa ashabil akhyar. Salatan wa salaman unajjib bihima min adabin nar. We extend thank you to IDBs to invite our organization in these forums. Okay, I will start the presentation. The study the smartphone habits of students in East Java, presenting by Student Research Center of Association Student of Nahdlatul Ulama. My name Haikal Atiq Zamzami. I am founder and executive director of Student Research Center, or SRC. I am also chairman of Student Union Nahdlatul Ulama, in Indonesian Ikatan Pelajar Nahdlatul Ulama. Okay, smartphone has brought great change in the last decade, as if the social interactions to digital interactions. This shift is very, very visible to the segment of students, has even led to an addiction to smartphones. We conduct this research with the strong assumption that student social interactions have shifted to digital interactions. Areas of research focus on urban areas. Thus, Surabaya, the capital city of East Java, and Sidoarjo. Because the biggest smartphone users are in urban areas, we start this research from the ownership of smartphones and the time range. Then we continue to explore the motivation of smartphones purchase. To determine the students' interactions pattern using smartphones, we explore the types of social media and frequently used applications. Last, we explore the reason that encourage students to use their smartphone. We found that 50% students have been using smartphones since elementary schools. The most common activity is to communication with others, social interaction or with social media. Why we are doing this research? In 2014, Java is the province with the second highest numbers of smartphone users, with 20.1 million users. The first this data is the result of survey conducted by Center of Communication Studies, University of Indonesia, or Pusakom, in collaboration with the Association of Indonesia Internet Service Provider. This is scientific data that relates to the problem. This is data. The green graphic is, the blue graphic is Java is 20.1 million user smartphone. Now the scientific data that relates to the problems. First, Pusacom survey result and subsequent APGII in 2016 presented the penetration of the internet users total in Indonesia populations by age 10 until the 24 years is 75.5%. This is a big percentage. Second, while the penetration rate was 69.8% based on the work of student. Third, the percentage of internet penetration is Java by 31%. Okay, statement of the problem. Surabaya is the capital of East Java province, while Sidoarjo is the closest district of Surabaya. Both these areas are metropolitan areas or urban areas. These two regions more than 1,000 schools and have the highest number of schools in East Java. The statement of the problem for this research is how the use of smartphone among students in Surabaya and Sidoarjo. Okay. The significance of the research. This research is important because as a student organization based on East Java, we need data on the use of smartphone. As we know, that the spread of information, both positive or negative, can be easily consumed by students. While most online media often publish about negative impact of using smartphone, while the internet user using smartphone increased. This justification of research. Researchers assess the importance of this research is due to several things. First, researchers have concerns the development, mentoring, and empowering of students. This research will greatly help researchers arrange the right approach pattern for students, because we are student union of Nahdlatul Ulama in East Java. Secondly, unavailability of data from previous research focusing on research subject in the segment of students. The data concerning smartphone usage among students is still too general, like result of APGGII result is too general. Description of study design. The study descriptive study using a quantitative approach with survey method. The study is intended to gather information, user data among Islamic students in East Java. Okay, description of some sampling technique and sample. The researcher took the study of a site of Islamic high school in Surabaya and Sidoarjo based on following reason. One, Surabaya is the capital city of East Java. Second, Sidoarjo is the district near Surabaya as the heart of province East Java. Thirdly, two of them are classified as urban and metropolitan areas where the level of user of smartphone is high. And then, the data of number of school and number of high school students of Islamic school in Surabaya and Sidoarjo. In Surabaya, there are 85 schools and 22.96 students. In Surabaya, in Sidoarjo, they are in Sidoarjo. In total, is the 170 schools. Source: Basic Data Ministry of Primary and Secondary Education and Culture in Indonesia Republic in 2016. This is the description of procedure we use to collect data. The researcher used survey methods in collecting data. Surveys in this study required the supporting instruments, questionnaire. In conducting the survey, the researcher made a number of questions relating to the use of smartphone amongst students in Surabaya and Sidoarjo, arranged in a questionnaire. Description of statistical methods. We use the Slovene theory, n per 1 plus n e quadrat. The research uses 5% in determining of maximum limit of error tolerance based on 46.9 and 24 student in Surabaya and Sidoarjo. If the data is formulated in Slovene with error tolerance level of 5%, the minimum number of sample is studied was 396 respondents. The researcher determined the number of sample or respondents is the study were 4,000. The result. From the data that has been processed, the result of this study are follows. Respondent answer related to question 1. This: does the student have a smartphone? 96.5% they answered have. Student didn't have, just 50%. This question 1. The related respondents answered question: since when students have a smartphones? 75% they answered have smartphone since elementary school. This is a unique findings of our research. And then, what are the reasons students buy smartphone? The most answer is communication. Is 54 percent the answer that's more than students communication as the main reason for buying smartphone. Then applications are often used by students uniquely, not Facebook or Twitter or BBM or WhatsApp or YouTube, but IG, Instagram, Line, game, photo, music, and video. This finding shows that more than half of students use social media application that emphasizes the visual features. Namely, IG, Line also play games and the other things. Facebook and Twitter were very rarely, and the rest abstained. Next, communicate. What do students do when opening an application? The big percentage of answer, communication with others. So half of students communicate among friends. The rest is divided on time and answer that listening music, browsing, the subject matter like mathematics matter and the others. Look
Sorry,
at the video.
Brother Heikel, you have 3 minutes more to go.
Okay. One more. Through this research, we recommended first, the government issued regulation that can improve the quality of education, the education in the digital era, especially the use of smartphone among students. Secondly, educational institutions and stakeholders must be able to be responsive and creative to the learning tools and media, especially through the smartphone. Third, student should be able to improve his self-control and understanding of the negative impact and consequences of improper use of smartphone. Okay? Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Thank you. Thank you very much. We'll move, in order to beat the time, let's move straight to the next speaker, Mr. Mash'al Al-Ribi'an, Director of Communications and Social Media from the Ministry of Health of Saudi Arabia, who is going to talk about the definition and types of social media application in the field of health, and the power of the social media. Thank you very much.
السلام عليكم ورحمة الله وبركاته. بسم الله والصلاة والسلام على رسول الله. Good morning everyone, ladies and gentlemen. I would like to thank you to invite me here to talk about Ministry of Health experience in social media during the past 9 months, including Hajj season. If you allow me, I will speak in Arabic. My presentation will be in Arabic because I think it's sometimes when you want to express something important, you want to talk in your mother language.
Okay,
So,
just before you continue, it's fine. There is interpretation available. So for those who don't understand Arabic, interpretation is available. You can use the headset to listen.
The translators are ready to translate? Yes?
Yep.
Okay. So, في وزارة الصحة اهتممنا كثيرا في الفترة الماضية بشبكات التواصل الاجتماعي وإيصال الرسائل التوعوية عبر وسائل التواصل الاجتماعي بطريقة مختلفة عما كانت في السابق. وزارة الصحة لسنوات طويلة عملت العديد من الحملات التوعوية للوقاية من الأمراض، ولكن بعد عمل استطلاعات الرأي اكتشفنا أن الكثير من الحملات لم تكن تصل إلى الأهداف المطلوبة. فتمحور السؤال المهم: لماذا؟ لماذا لم نصل إلى الهدف الأساسي من الحملات التوعوية اللي كانت بالسابق؟ لأنها كانت مكررة ولم تكن تتكلم بلغة الشاب أو لغة الشارع أو لغة المجتمع، بل كانت حملات توعوية بقالب معين. على سبيل المثال، عندما نتحدث عن التدخين، جميعنا هنا يعلم أن التدخين يسبب السرطان. من منا لا يعلم ذلك؟ هل المدخنين توقفوا عن التدخين عندما نقول لهم أن التدخين يسبب السرطان؟ بالطبع لا. هل الأشخاص ذوي الوزن الزائد مارسوا الرياضة عندما قلنا لهم أن الوزن الزائد يسبب الأمراض؟ طبعا لا. ولكن لو تحدثنا بالعواطف وقلنا للمدخن أن ابنك، والدك، والدتك، أختك، أخوك يحتاجك أن تكون معه، هنا اختلفت الرسالة. هذه مقدمة لما عملنا عليه خلال الفترة السابقة. سوف أتحدث عن شبكات التواصل الاجتماعي في العالم، عن الإنترنت وشبكات التواصل في الشرق الأوسط وفي المملكة، وعن تجربة وزارة الصحة السعودية. سوف أمشي سريعا في العرض التقديمي. الزملاء عندما عدوا هذا العرض أعدوا 80 سلايد، أعتقد 80 سلايد. إذا استمريت في الضغط على هذا المؤشر سوف أستغرق 15 دقيقة، فلذلك سوف أحاول التحدث بسرعة. هذه بعض الأرقام ولعل الزملاء تحدثوا عنها. هناك أكثر من 54% من مستخدمين الإنترنت في العالم، و66% يستخدمون شبكات التواصل الاجتماعي والموبايلز. هناك نمو سنوي كبير جدا وطلب على استخدام الإنترنت وعلى الموبايل يوزرز والسوشيال ميديا يوزرز. لو نلاحظ هنا 30%، وهو رقم كبير وارتفاع مضطرد. توزيع للمناطق، الجلوبال انترنت يوز. سوف أذهب مباشرة إلى ما يتعلق بالشرق الأوسط والمملكة. بعض الأرقام، جميع هذه الأرقام أتمنى إذا كان بالاستطاعة مشاركتها. في المملكة العربية السعودية هناك 25% من السكان يستخدمون الفيسبوك، 15% يستخدمون جوجل بلس، 20% للتويتر، 11% لينكد ان، 17% الانستغرام، و13% لسناب شات. اليوم طبعا نحن نتحدث عن السعوديين وغير السعوديين المقيمين داخل المملكة العربية السعودية، ولا نتحدث عن القادمين للحج أو للعمرة وهم أيضا بالملايين. نحن نتحدث عن المقيمين والمواطنين. هذه الأرقام تعطي مؤشر كبير جدا أن أفضل وسيلة لإيصال الرسائل التوعوية وتغيير اللايف ستايل هي شبكات التواصل الاجتماعي. تجربة وزارة الصحة. عمدنا في وزارة الصحة إلى أولا تعزيز الثقة أو إعادة الثقة لوزارة الصحة من جديد. مهم جدا أن يكون المصدر أو مصدر المعلومات لديه ثقة عند المجتمع، وإلا لن يتم الاستماع له. لهذا عملنا على إبراز الجهود، تعزيز الصورة الإيجابية، نشر الأخبار، مكافحة الإشاعات، التواصل مع المجتمع بلغة سهلة. التواصل مع المجتمع بلغة سهلة يفهمها، تعريف بالخدمات ورفع المعرفة، ومن ثم قياس الرأي العام. استخدمنا طبعا عدة منصات: تويتر والفيسبوك والسناب شات واليوتيوب، والتي رأينا أنها أكثر المنصات إقبالا من قبل السعوديين والمقيمين داخل المملكة العربية السعودية. اعتمدنا في وزارة الصحة وتحديدا في تويتر على جزئين: على الحساب الرئيسي وهو ما ينشر الحملات التوعوية والأخبار التوعوية والجهود وغيرها، والكاستمر سيرفيس آرم اللي هو خدمة 937. وبالمناسبة لكل من موجود هنا، وأوصلوا هذه الرسالة لجميع من تحبون، خصوصا للمقيمين داخل المملكة العربية السعودية وحتى لغير المقيمين. الرقم 937 قد ينقذك في يوم من الأيام. احفظوا هذا الرقم جيدا. هذا الرقم بالإمكان الاتصال عليه وطلب أي خدمة أو تقديم أي شكوى. فعمدنا في شبكات التواصل الاجتماعي وتحديدا في تويتر الأكثر تفاعلا على وضع حساب خاص ب 937. هذا الحساب هو من يتفاعل مع الناس، يرد عليهم، يأخذ شكاويهم، يحلها، وأيضا يقدم لهم الاستشارات الطبية. بدأنا بخلق التيليميديسن داخل المملكة العربية السعودية عبر تويتر وعبر الهاتف، وقريبا عبر الموبايل عن طريق تطبيق إلكتروني يتم من خلاله التواصل مع المرضى وعلاجهم في بيوتهم. طبعا سوف أذهب مباشرة إلى كيفية صناعة المحتوى، وهو أهم جزئية لإيصال الرسالة المطلوبة. تحديد المحاور، استلام المواد الخام الرو ماتيريالز، الصياغة، تصميم، اعتماد، إجراء بعض التعديلات إن وجدت، جدولة، نشر. هذا يشكل 70% أو 60%. الأهم بعد هذا كله، الأهم المتابعة والرصد. عندما نقوم بعمل حملة توعوية معينة، من المهم جدا أن نعرف عائد وأثر هذه الحملة مباشرة بعد انتهائها. هل نستمر، نتوقف، أو نغير الاستراتيجية في هذه الحملة؟ وكما ذكرت في بداية الحديث، أحيانا تكون الحملات مملة جدا وليس لها أي قيمة، فبالتالي قياس الأثر، المتابعة والرصد، هي من تحدد الحملة أو الحملات القادمة. المحتوى له عدة أشكال، ولعل صورة تغني عن 1000 كلمة، وهذا ما نحاول دائما أن نستخدمه في وزارة الصحة لإيصال الرسائل للمجتمع بصورة. نص مقرون بصورة. نص فقط قد لا يكون مفيد وقد لا يوصل الرسالة التي نريدها. اليوم هناك الموشن جرافيك. الموشن جرافيك أيضا وسيلة فاعلة ومهمة ومؤثرة يتم استخدامها في الحملات التوعوية لوزارة الصحة، ثم يأتي الفيديو والإنفوغرافيكس. لدينا عدة أهداف في وزارة الصحة. أولا أن نعزز من الصورة الإيجابية، وكما ذكرت تعزيز الصورة الإيجابية للمنشأة يعطيها موثوقية أعلى، فبالتالي يمكن للمتلقي تصديق هذه المعلومة بأنها من مصدر معتمد. إذا بدأ المجتمع يشكك في المنظومة أو في المنشأة، فلا يمكن أن يستقبل منها أي معلومة كانت، فكل الحملات التوعوية تصبح يوزلس، تصبح بدون أي فائدة. طبعا لتعزيز الصورة الإيجابية عملنا عدة أمور، من ضمنها جهود الوزارة الصحة في حج الموسم الماضي. وردنا العديد من التعليقات وردود الفعل لأناس يقولون لأول مرة نعرف أن المملكة العربية السعودية تجري عمليات القلب المفتوح للحجاج مجانا. لأول مرة، مع العلم أن هذا الأمر تقوم به المملكة العربية السعودية للحجاج بالمجان منذ سنوات، ولكن كل هذه الجهود لم تكن مغطاة إطلاقا، ولا أحد يعلم عنها، لا السعودي ولا غير السعودي ولا حتى الزائر للحج أو للعمرة. جميع الخدمات الصحية تقدم للحجاج مجانا بدون أي تكاليف إضافية. هذا من الخدمات التي تقدمها المملكة العربية السعودية للحجاج. الإعلام لا يعلم عن هذه الأمور، والتقصير من الوزارة نفسها. لم تكن الوزارة حريصة على تقديم نفسها بالشكل المطلوب. في حج الموسم الماضي كان هناك حملة إعلامية ضخمة تغطي هذه الجهود، جهود وزارة الصحة التي تمثل أيضا المملكة العربية السعودية في خدمة الحجاج، وهو واجب على المملكة وليس فيه منه. تم نشر العديد من التغريدات في وسائل التواصل الاجتماعي. هذه بعض النماذج من هذه التغريدات. التغريدات شملت على أمور توعوية للحجاج. مهم جدا أن نعلم جميعا أن المملكة العربية السعودية اليوم هي لنقول الحارس الصحي للعالم أجمع. متى ما تم الحفاظ على صحة 1,000,000 أو 2,000,000 شخص في مكان واحد، فهؤلاء سوف يخرجون من هذا المكان أصحاء إلى بلدانهم. وإذا لا سمح الله لم يكن هناك مراعاة صحية لهم، فسوف يخرجون بأمراض ينقلونها إلى سائر العالم، فبالتالي ينتقل المرض. والعكس صحيح. المملكة أيضا وضعت حواجز صحية في المطارات وفي المنافذ تقوم بها وزارة الصحة لمنع وفادة المرض لداخل المملكة العربية السعودية، ومتابعة كبيرة جدا مع منظمة الصحة العالمية للأمراض المنتشرة في العالم لمنع قدومها للمملكة وانتقالها بين الحجاج، وبالتالي خروجها مرة أخرى إلى العالم. هذا أهم أمر تحرص عليه وزارة الصحة. لهذا وسائل التواصل الاجتماعي مهمة جدا للحفاظ على صحة الحجاج، وبالتالي صحة العالم كله، عبر التوعية سواء في وسائل التواصل الاجتماعي أو التوعية داخل المناسك في مكة ومنى وعرفات ومزدلفة. طبعا نموذج أيضا من تغطية حساب الوزارة في سناب شات، استخدام المؤثرين. يعني we are using the influencers. It's very important and يعني very important tool using the influencers. فاستخدام المؤثرين لإيصال الرسائل مهم جدا. third party strategy. استراتيجية الطرف الثالث مقنعة جدا. دكتور بشير أنا منطلق بالحديث، فإذا كان فيه الوقت تنبهني. أيضا اليوتيوب، مشاركة قناة اليوتيوب في المناسبات وتغطيتها وإرسال الفيديوهات وغيرها. هؤلاء بعض المشاهير أيضا أو المؤثرين الذين تم مشكورين تقدموا لنا بالمساعدة والتفاعل، إحساسا منهم بوجههم الوطني، تفاعل لما نشر في تويتر خلال موسم الحج. الهدف الثاني هو أن تكون الوزارة لنقول السد المنيع للإشاعات. الإشاعة قاتلة إذا لم يتم السيطرة عليها. هناك نظرية أو استراتيجية First Dancer Strategy. First Dancer Strategy في السوشيال ميديا. هذه الاستراتيجية متى ما تم استخدامها بالطريقة المثلى فسوف تحد من الإشاعات. في وزارة الصحة نحرص على معرفة أي إشاعة وقت ظهورها والقضاء عليها في مهدها قبل أن تكبر كرة الثلج، فنتحول من القضاء على الإشاعة إلى damage control، وهذا أسوأ ما يمكن أن نصل إليه. الإشاعة مشكلتها تكمن في ذهاب الناس إلى مصادر أخرى للعلاج. على سبيل المثال، إذا ظهرت إشاعة أن هناك معالج شعبي للشلل وكبرت هذه الإشاعة، فسيبدأ الناس يذهبون إلى هذا المعالج وتكون الأمور أسوأ مما كانت عليه. الزملاء يبدو الوقت يداهمنا، فبالتالي الهدف الثالث أن نتواصل مع المجتمع بكل فئاته والإجابة على جميع التساؤلات من خلال خدمة 937 كما ذكرت في بداية حديثي. الهدف الرابع هو التعريف بالخدمات وكيف يمكن للناس أن يصلوا إلينا. اليوم الناس لا يعلمون أين يوجد المركز الصحي، أين يوجد المستشفى، أين يوجد كيف يتصلون ويعرفون الخدمة الطبية من مهام وسائل التواصل الاجتماعي. وكل هذا بالمناسبة يصب في صحة الشباب، كل هذا يصب في صحة المجتمع والحفاظ عليه. فهذا من الأهداف أيضا أن نوعي الناس. رفع مستوى المعرفة بالشؤون الصحية والثقافة الصحية، هذا أيضا من الأهداف التي نسعى لها من خلال وسائل التواصل الاجتماعي. هناك طبعا كيف طريقة الحملة وكيف تتم ونماذج من المحتوى التوعوي. ميرس، كورونا، واحدة من أهم الأمور التي عملنا عليها للقضاء على توعية الناس. انخفض معدل الإصابات في كورونا 66% خلال سنة. 66% decrease in MERS in Saudi Arabia. 66%. Why? Awareness campaigns only. Awareness campaigns only. So فهذه الحملة معا للوقاية من كورونا ساهمت في هبوط معدل الإصابات، وهذا دليل على قوة. أيضا حملة السرطان الثدي ساهمت بشكل كبير باكتشاف العديد من الحالات بشكل مبكر وإنقاذ العديد من النساء الشابات من تداعيات المرض في خصوصا سرطان الثدي. وهو يعني this is not a formal language. وقفوا عند حده. This is not a formal Arabic. هذه لغة يعني عامية قليلا. عن السكري، وساهمت بشكل كبير ملايين المشاهدات 1 billion views في جميع شبكات التواصل الاجتماعي. الهدف السادس قياس الرأي العام تجاه الوزارة وخدماتها لمعرفة هل نحن نمشي على الطريق الصحيح أم لا. التقارير التي تصدر ونماذج من التقارير. هذه هي النتائج بعد كل ما عملنا. We have 1,200,000 followers on Twitter. 1.2 million followers on Twitter. Saudi at Saudi MH. YouTube. Thousands and hundreds of thousands of views. We have more than 20 accounts. عندنا 20 حساب للمناطق. في كل منطقة هناك حساب خاص بالمنطقة نفسها. الصحة في الرياض، الصحة في جازان، الصحة في مكة، وهلم جرا. العائد طبعا على المجتمع، رفع المستوى الصحي والوصول للخدمات وغيرها. هذا ما عملناه خلال الفترة الماضية، ونعتقد ومؤمنين تماما أن شبكات التواصل الاجتماعي هي القناة الأهم لتقليل المرض والمحافظة على المرض. وبالمناسبة أريد أن أختم بكلمة. عندما تم تعييني كمسؤول عن التواصل في وزارة الصحة، أبلغني معالي الوزير الدكتور توفيق الربيعة بأن أهم ما نريد أن تركيز عليه خلال الفترة القادمة هو التوعية. prevention هو أهم أمر. شكرا جزيلا لكم واعتذر عن الإطالة.
ونحن نقدم شكرنا إليك. This is excellent. We have had the Saudi Arabian experience. This is the beauty of these kind of events. Now we move to another member country, Turkey. I would like to invite Mr. Mehmet Dink, clinical psychologist, Hasan Kliyonku University in Turkey, who is going to make a presentation on the excessive use of the internet. Thank you, Mr. Hasan.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. It is a great honor to be here with you today. First of all, I would like to express a clear standing point of us about internet addiction and social media addiction. Talking about internet addiction doesn't mean that we are against technology or social media. In fact, it is opposite. We support using technology wisely and safely. We encourage people to ask 3 questions to themselves when they use internet or social media. They are, if their usage of internet makes their life easier or more difficult. or if their usage of internet makes their life wider or more narrow, or the other one, if their usage of internet make their lives more rich or more poor. To do that, to understand this, they need to focus on 5 different things. First one, the aim of usage. What is the intent of using of internet? The other thing is timing, how much time they spend. And the third one is the content, what kind of website they visit regularly. The fourth one is real-life responsibility, how their usage of internet help them to experience their real life of responsibility. And the last one is the real-life identity, how much it is affected. I'll tell you about our works as a Green Crescent about this issue, but first of all, I would like to show some statistics about Turkey. The population of Turkey is almost 80 million, and most of the Turkish people are active internet users. And most of them, more than 40 million people, are Facebook users, and we have a very big young population. They are mostly active in social media. And I would like to let you know about some statistics as well about using social media. As you can see, the most popular one is Facebook and WhatsApp. And the timing is another important thing, how much Turkish people spend their day in social media. The statistics is 2015 is statistics. As you know, it's growing thing, so I guess it is much more than 4 hours. It's almost 6 hours for some people, 7, 8, 9, it's going up. Epidemiology of internet addiction in Turkey. Since 2000, there are so many papers published in Turkey about internet addiction. And mostly these studies were conducted on students from middle school, high school, and university. But unfortunately, we don't have any larger scale nationally representative studies. But according to the studies, we know that 1 to 10% of users are seen as an internet addict. And 15 to 30 of users are seen at risk group for internet addiction. And the findings are consistent with international literature about physical, emotional, social, and mental health problems regarding excessive internet use and social media use. From government point, there are some legislation. Although internet addiction and gaming addiction is quite popular topic in academia, media, and public forums, there are not enough legislation about that, but we have a very popular one legislated in 2007. According to this act, this kind of website are accepted as a criminal website, led to suicide, pedophilia, facilitating opioid or stimulant use, facilitating any kind of dangerous material for health, obscenity, prostitution, and facilitating gambling. Also, we have a national filtering system towards illegal pornographic website. If anyone would like to visit any illegal pornographic website in Turkey, he can see this screen and he cannot enter without any proxy website. Also, government provide a free and easily accessible software for age-appropriate content for families. So if you just can subscribe this software, you can be sure that you cannot enter any gambling or adult websites. About the treatment, in Turkey since 2010, we have so many private practice in internet addiction treatment. Also, since 2013, one of the biggest mental health hospitals in Turkey provide treatment for internet addicted people. And also we offer education program for psychologists and psychiatrists. The first master program was opened 2 years ago, a Psychology of Addiction Master Program at Hasan Kalyoncu University. Also, clinical psychology program provides elective courses on addiction, including internet addiction, and also some psychology undergraduate programs offer courses on addiction, including internet addiction. So let me talk about what we are doing as a Green Crescent Society about internet addiction. The Turkish Green Crescent Society is 96 years old NGO, and we have more than 100 professional workers in our general office in Istanbul. In more than 100 universities, we have Green Crescent Student Club, and all around Turkey, we have more than 100 local branches, and also we have international branches in 35 countries. The main focus of a Green Crescent Society is fighting with addictions. Since 2010, we focus on 5 different addictions: alcohol, drug, tobacco, gambling, and internet addiction. To do that, we develop a training program which is called Turkish Fighting with Addiction Training Program. In the first year, we developed a program step by step for age-appropriate program. For this program, our 500 trainers delivered this training to 28,000 school counselors, and the 28 school counselors delivered this training program to 10 million school students in 2016. At the end of this year, we are planning to reach 20 million school students deliver this program. You can see some of our publication we use in our program. As I said, it is about their development. The first one prepared for kindergarten students. The second one is prepared for primary school students. The third one is prepared for middle school students. And the last one is prepared for high school students. And also we published a book, the first book in Turkey, in fact, about internet addiction in 2010. It was written by myself. And also we published a scholar journal about addictions, but last year we published a special issue on internet addiction in that journal. Also we published so many scholar articles, research articles in that journal. As a Turkish Green Crescent Society, to understand the problem more widely and more clearly, we support a master and PhD program if master and PhD students would like to work on internet addiction. We provide scholarship for $4,000 for master thesis and $6,000 for PhD thesis. Also, for local NGOs, we provide grant program if they do something about internet addiction in their village or cities. We provide $30,000 per project. And also, if a young person, a university student person, who is not involved in any NGO and would like to do something about internet addiction in their university, we also provide a grant program for them as well. Very important organization for us, the first Technology Addiction Congress in the world, organized by Turkish Green Crescent in 2012. Nationally and internationally well-known academics and practitioners contributed this Addiction Congress, and we organized the second one and third one in 2013 and 2016, and we will organize the fourth one at the end of this year, December. You are all invited. We will be more than happy if you attend our Congress of Internet Addiction. For the people who cannot reach our training program in cities because they are far from the cities, we organize virtual classes online to deliver this training as well. Also, we organize national workshop on internet addiction, which make all stakeholders together. Also, we organize youth awareness camp to make young people outside, and we organize public service broadcasting to promote awareness about internet addiction. We organize national comics competition. also national bicycle tournament in more than 30 cities, and more than 30,000 people attend this tournament. And also we organize nation scenario competition, short video competition, and the very important organization we are doing, training programs for NGOs, team coaches, sportive people, religious leaders about internet addiction and what can they do about that. Before to finish, I would like to give you trends in Turkey now. Most of the studies focus on general internet addiction instead of specific internet addiction in Turkey. But a new trend in research shows that specific internet addiction, such as online gaming, gambling, sex, and shopping addiction, will be main topics in internet addiction research in near future. So we would like to focus on this specific internet addiction in the following years. Thank you for your patience.
Thank you so much, Mehmet. This is quite interesting. We have had the Saudi Arabian experience. Now we have had the Turkish experience. A very, good thing is how active our member countries are becoming in taking this issue of the social media, internet addiction seriously. And I think there is more to discuss about this when we come to the panel discussion. The final speaker before we go for break, I know people are getting tired. We'll have a break shortly. I would like to invite Dr. Muafa Hossi, who is going to speak on the impact of social media on Arab youth healthcare perspective. Thank you very much.
Assalamu alaikum, everybody. Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. I start off with a joke in Arabic, and I'll translate in English, inshallah. I got this actually a few days ago through social media as well. إجابة شيخ على سائل. السائل لديه سؤال. شيخ تفضل. السائل: شيخ صف لنا حال السلف مع القرآن. فأجاب الشيخ وقال: مثل حالكم مع الجوال. Subhanallah, today, حتى even as we're doing the talk, I'm observing, and I see everybody as the talk is happening, we're all, even myself, we're on our phones, we're addicted. We're addicted to our phones. We're addicted to social media. All of us. I'm sure we have addicts in this room, all right? And it takes away impacts from our family, from different perspectives in our lives. And I'm here to talk about a few things and the impact that it has on our health. And I'll talk some of the negative and some of the positive things as well. I'll skip. Okay. A lot of the speakers touched upon some of the things that I will talk about, so I'll skip those, what are relevant and what is not. Okay? So what is social media? A definition, basically, that it's a group of internet-based applications that build on the ideological and technological foundations of Web 2.0 that allow the creation and exchange of user-generated content. Everybody uses here. How many people use Facebook? Put up their right hand. How many people use Instagram? Put up their left. I'm sure both hands if you use WhatsApp. Yeah, everyone, WhatsApp. Huh? So everybody, WhatsApp is a big thing and has a big impact on our society. Some of my colleagues shared these important figures. We have over 50% of the population of the world using the internet. Active social media, 37%. Unique mobile users, 66%. And active mobile people, 34%. There's a lot of people using the social media, the mobile phones, and so forth. And you can see the different distributions of social media penetration across the world, and you can see that the Middle East, we're about 38%, which is pretty high, okay, compared to other countries in South Asia, which can get down to 15%. A social media use in the regional overview. I don't know if you can see these slides. We're not that clear, but we're still high in the Arab world. And we look in the Middle East in general, in the Arab world, 94% the highest on Facebook, then Twitter, Google, Instagram, and LinkedIn. Okay, the most popular social media websites. And this is, I know this is a graph. It talks about the different uses of social media in the different countries in the Arab world. And you can see Facebook and WhatsApp are generally the main two. Facebook and WhatsApp, they're generally primarily two social media platforms that are used in the Arab world. Again, here we see more data. This is the average length of sessions in the Arab world as well. And I'll just keep on going. Some quotes that we found in a report. A 15 to 24-year-old Moroccan female. We spend more time with people on social media than with others in real life. A Lebanese male. These are youth. When I wake up, I check my phone and find out what my friends message me over WhatsApp or Facebook. I check all updates. So when I don't have a college, I see who's available and plan for something with him. In Saudi Arabia, our colleague Mishal talked about some of the statistics. We have about 31.8 million people population. Active social media accounts, 11 million. And active mobile social accounts, about 10 million. And active internet users, about 2/3 of the country. Facebook, Twitter, and Instagram, Google, and LinkedIn are some of the top used social media sites in the country. WhatsApp, when we talk about active social chat apps, we're not just, you're talking about networking platforms where actual people are chatting, WhatsApp is number one. Across the world and across the region in general. In Arab news, it's a local English media journal. It talks about a newspaper. Saudi Arabia social media users ranked 7th in the world. So we have a high penetration and use of social media here within the country in Saudi Arabia. We look at youth in the Middle East, and as a percentage of the population, we have a huge, most of our population in the Middle East are youth, are the youngsters. And a lot of them are using social media, interacting, getting to know each other, and doing a lot of things. And look at the population pyramids. If you look at Japan and Western world, people are getting older. Okay, look, this one is on the right hand. This is the Japanese, but you look on Saudi Arabia onto the left, and this is most other Arab countries as well. Most of the population are youth. So when you talk about social media and the impact on health of the youth, I tried to look at the social determinants of health model, where they talked about elements from the environment, youth, learn and play, and how it shapes their physical, mental, emotional, and health well-being. We're not talking about health in terms of physical, we're talking emotional, mental, and other types of health issues when we talk about the social determinants of health. So what I did, I looked at, so what are the studies in the Arab world? We barely have any good studies. I was admiring the work from Turkey, and look, they have a journal, they have conferences, just on a particular part of internet addiction and social media. In the Arab world, we don't have that. We have a few studies that I was searching, and some in Arabic, very few in English, and it talks about mental health, that social media causes loneliness and depression in Arab youth, isolating themselves from society and creating for them multiple identities online and at home. Okay? When we look at from health behaviors, these are other studies here that were found in the Arab world. Social media used to change cultural practice of Saudi youth by encouraging to pursue on youth, go to parties, to eat, to fornicate, to do many, many bad things in terms of health behaviors. Okay, people are promoting to do negative things, not positive things as well. Drug addiction. These have shown media to fight drug addiction on youth. So the work that this is from جامعة نايف العربية للعلوم الأمنية, some of their work that they're talking about Facebook and drug addiction, and explored how Facebook groups relating to drug addiction and how there needs to be an awareness campaign for youth and use videos to create awareness. Social media can have a positive impact on how the youth can interact and learn about drug addiction and so forth. So there's more needed. Misinformation. Mishal was talking about that earlier, about the false rumors aimed at the internet and some of the information that can be health related. A true story, there was a lady that she read online that if you put toothpaste on your acne, it'll help get rid of it. And the girl did, and what happened? 2 days later, she woke up, but she found holes in her face. All right? And she went to the doctor, how can you help me? Well, where'd you get this information? Well, I found it online. So misinformation and this, we need to create awareness. How do people, this concept of health literacy. We might be literate to read and write, but not a lot of us know how to actually to read and critically appraise information that we read online. And most of the information that we get is online from platforms in the Arab world. We don't have a good source of information. There's one from our university, King Abdul Aziz University of Health Sciences, Mawsu'at Malik Abdullah, for health. So we have an health encyclopedia that's based on evidence to help people understand healthcare and know it from a best practices so they don't get into this problem of misinformation. Physical harm in Saudi Arabia. There are also as well where people on social media, they're attacking each other. All right? People here are physically threatening each other because of soccer and so forth. If you come to this place, we're going to beat you, we're going to do this, and so forth. So this physical harm, bullying, we're talking about cyberbullying. It happens and it occurs, and just from soccer, just about soccer, and it's dangerous. Dr. Sarwa al-Bahkali, who could not be here, is doing something great online. She's looking at women's health. She's a practicing physician, a Saudi physician, and she created social media through Twitter, and now she's going through Instagram. We work together. She talks about women's health, not just in Saudi Arabia. She helps people in the Gulf region and the Arab world where they ask her questions, and she takes the time and effort to actually answer the questions of people that they have relating to women's health, from breastfeeding to marital, spousal information to many, many other things. So anyone, she spends her time. And you know, for a physician to take her time and to go and spend hours, she is a dedicated person, and not a lot of people can do that. It burns her out. It's a burnout. So we need help. We need incentives. We need models to help physicians. When we're talking about influencers earlier, we need people within the community that can influence our youth, that can help ask questions and answer them in a very scientific, caring, and give them the support that they need. Okay? Also privacy. Awareness is needed on how to share information on Facebook, on social media. This is the Saudi Journal of Medicine and Medical Science. These are all studies that I'm talking about, referring to. They're talking about sharing health-related data online without knowing the impacts of doing so. A lot of our youth, they don't really, social media is cool, and they share information. They don't know that their employer, anyone can actually find that information about them related to their health. They can be sick or looking for information. Well, this person is sick. Well, we're not going to hire them. He has some kind of problem. People don't know about this. We did many studies, and one of them a few years ago about sharing sensitive health information on social media in the Arab world. And it was very sad. We looked at Facebook, and we looked at different Arab countries. And what we found, for example, a story of a man who has HIV in Morocco. He goes online seeking help, and he found a nurse. And please help me. I'm worried about my family. I can't reach out to anyone. I have no resources. I'm here because I need help from you, from the group. And she's playing him on. She's talking to him. And she says, tell me more about your disease. How did you get it? And he's talking about his relationships and drugs and so forth. You know what she says at the end? She says, well, you know what happened to you? You deserve it. It was very sad. And this person was shocked. And you can read, because we're analyzing all these comments. People in war-torn areas, in Yemen and Syria, seeking help. We found that people are going online and they're sharing their medical records. Please help me. Here's my medical record. Here's the hospital. Here's what happened to me. They're sharing information. When we talk about privacy and the importance of privacy, it's important when everything is normal. But when you go through war or hardship, people share their information online because they need help. And we don't know about the impacts of sharing sensitive health information. Our youth don't know. They don't know that sharing sensitive, this stuff is online. That's it. It's on there forever. You can't change it. People have it. People see it. We don't have that concept. So there was many issues in that study that we found, and many other studies as well that we're doing relating to the positive and the negative effects. But we need more research. I wish we did more research like this in Turkey, and some of the stuff that the work that the Ministry of Health is doing that we can share and learn from that and study it. And you talked about many of the impacts, Mishal, about the impacts of social media. But I question if we know the actual if we study that, to actually know the impact. Was this a result of social media or other things? We need more of those studies to actually know what are the impact of social media from both a positive and a negative way. And from the research that I've been doing, we don't have much. We don't have much in Saudi Arabia. We don't have much in Egypt. We don't have much in Syria, in Jordan. We just have a few studies here and there, nothing comprehensive, nothing as a group work, and so forth. Conclusion, Arab world, the youth are empowered in using social media. Remember, our biggest population in the Arab world is our youth. We have to invest in them. We're not like Western countries where people are getting old. They're trying to get our youth. They're trying to get the youth to come, all right? We need our youth. We need to take care of them. We need to show them, empower them, and they are being empowered, and they're doing amazing stuff. But we need to help them. But there's also risks involved in issues such as addiction, that are harming mental health, impacting mental health, destroying our cultural and religious norms as well, and sharing sensitive health information online. So we need to work together as a group, and I'm really happy that this session, the Islamic Development Bank, has brought us here together. And I really want to thank you for the information that I'm learning from my colleagues as well. And I hope we can cooperate and do something, because we need to invest in our youth. They're the most important resource that we have. And we need to spend the time, the effort. And social media, they're all connected. Most of them are connected. We can get through them, but we got to get through them in the right way, in the right manner, before anyone else does. And thank you very much. Assalamu alaikum.
Thank you. And I couldn't think of a better conclusion to this session. We need to work together. And I think this should be part of the things that we should discuss when we come to the panel discussion after the break. So please don't go away. This is important. It affects you. It affects me. It's about the future of our kids. It's about the future of our countries. So please make time to come back. We will close the session. We'll be back here right within 20 minutes to have the panel discussion. Thank you.
Okay, assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Thank you, Brother Jamil. We have had the opportunity to be exposed to the magnitude of the effect of the social media at the global level, as well as the experiences from Turkey, from Saudi Arabia, and Indonesia. At this point in time, we would like to complement our picture by asking Mr. Irfan Shaukat, who is the Director General of Science and Technology at the ODC, to summarize the situation at the OIC member states and the way forward in the issue before we step to the other panelists. Mr. Shaukat, you are welcome.
Thank you very much, Dr. Salam. And I'm thankful to IDB to arrange a seminar on an issue which is of importance to the whole world and also, of course, for the OIC member states. The Organization of Islamic Cooperation represents a diversified group of 57 member states. Geographically, they are located in Africa, Asia, most part of the Asia and Caribbean. They are diversified in the technology acceptance as well. If we look at the diffusion of the technology in the member state, we can find some interesting facts. Before starting and giving my conclusion, let me put you the figures so that you can see how the OIC member states are doing in terms of their technology penetration. In nearly 43 OIC countries, more than 90% of their population does not use mobile social media. On the other hand, 10 countries have mobile social media rate in excess of 70%. Now, if we look at the use of internet in 2015, 3/4 of the citizens of 30 OIC countries are not using internet, while in 18 countries, more than half of the population is connected to the internet. If you look at the mobile social media internet usage, half of the population in 54 member states is using mobile phones. And even in more than 23 countries, The mobile usage subscribers are more than 100% of the total population. What does that mean? That means that there is a clear digital divide between the OIC member states. OIC states, countries are not a homogeneous groups, and they are still lagging behind the rest of the world as far as the use of the technology is concerned. But at the other spectrum, the total population of the youth in the OIC member states is more than 53%. There are technological issues to catch up. If at a rate of 21% increase every year for the social mobile users, it is hoped that in the next 10 to decade, the number will be increasing. But at the given time, the use of the social media is not that effective and not that much in the OIC member state as compared to the rest of the world.
Thank you very much. I will now give the chance to Mr. Michel Maginot, who is a PhD student at COUTS. He's majoring in microbiology. And I would like to extend to him the following question, which will be also to Miss Maha Saleh, who is a journalist and social activist from Jordan. Could you please tell us to what extent the social media has contributed to reshaping the behavior and the attitude of the youth?
Yes, well, I can give a personal example in this case. That would be, I would say, good lesson. So I think, first of all, there are different stages, even for youth, when social media plays a very important role. And one of them, I would say maybe one of the most important times is during teenage years, of course. And here we talk about adolescence. At that time of excitement, of course, teenagers tend to absorb, I would say, content from social media without maybe too much discernment or being able to distinguish what is good for them or what is bad for them. I was personally faced with this few years back. Here I also refer to the people that you normally add as friends or contacts to your network and so on. So basically you start into adolescence to absorb all of this content and all of this information, and I would say that teenagers are not generally prepared to manage all of this information, and the brain in a way can get overloaded with all this content. So from a personal standpoint, about a year ago, I'll just give the example of a Facebook account. I've completely closed my previous account and I created a new one. And I said, I just want to keep these meaningful relationships with the people I really interact with. And basically from having about maybe 2,000 friends on my Facebook network, I ended up having about 300 in the new profile. Also, I became more careful with the groups and with the pages that I was following, because in the end, all of these notifications come to you every day. So I would say that it takes some time for adolescents, and especially for youth, as it was my case, to learn what is good and what is not good for me, and focus on the meaningful aspects and the positive aspects of social media. I still use social media, and my colleagues in the university and my friends, especially those who are away from their homes, they use it. It is mainly for communication, as we learned, but I think it's the most important aspect here is to really focus on what brings a positive energy and the positive aspect to you.
Excellent. Michel has raised a very important issue in the use of the social media. He stated that actually majority of the youth are not generally prepared, and he gave his own experience that through his discretion, he was able to decide to close one of his old account to open one so as to get rid of a lot of unnecessary information from which I have understood. Now, the same question I would like to direct to Mrs. Maha. Mrs. Maha is a journalist. She is a young lady. She is a social activist, and she is from Jordan. Could you please tell us to what extent you feel that, is it whether it is related to your own experience or the experience in Jordan, to what extent you feel that social media has contributed to shaping or to affecting the behavior and the attitudes of the youth with respect to their health?
Assalamu alaikum. Allow me to speak in Arabic. عالم السوشيال ميديا من أكثر الأشياء اللي أنا كتبت عنها بالصحافة وبمقالات. طبعا أنا بعتبر دائما السوشيال ميديا هي عبارة عن سلاح ذو حدين. إحنا بنقرر شو السلاح اللي نستخدمه. لن أكون مثالية لكن أتحدث بواقعية. طبعا السوشيال ميديا ساهمت مساهمة كبيرة بوصول إلى ما أنا عليه الآن. كانت الانطلاقة من السوشيال ميديا بنشر كتاباتي بداية، بنشر مقالاتي، بأخذ رأي الناس عن كثير من المواضيع الاجتماعية التي تهم المجتمع بكل أطيافه بكل أفراده، مواضيع اجتماعية، مواضيع اقتصادية وسياسية. طبعا السوشيال ميديا ساهم في نشر الفكرة الجيدة اللي تعم أكبر شريحة من المجتمع. ساهم بالوعي مثل ما تحدث الدكتور الأويرنس كامبينز. ساهم بأنه نوصل إنجاز ما أو تحدي ما أو تطور ما في مجال ما في الحياة لأوسع جهة. ساهم أنه يختزل هذا المجتمع الكبير والعالم الكبير لعالم صغير. اعتبرته هو عبارة عن عالم افتراضي، لكن ضد أنه نعتبر عالم السوشيال ميديا هو عالم افتراضي بديل عن العالم الحقيقي. لأنه طبعا بدنا نتحدث عن الجوانب السلبية للسوشيال ميديا. طبعا ساهمت في خلق عزلة وانطواء للكثير من العالم من الناس بكافة المراحل العمرية. طبعا في داخل البيت الواحد كل شخص في البيت له عالمه الخاص مع استخدام الموبايل، اللابتوب، كل الوسائل. قلل من التواصل الاجتماعي، الفيزيكال ابروتش، زاد من إفراز المشاكل الاجتماعية والمشاكل النفسية. جعل العالم كله تحت ميكروسكوب مراقبة تصرفات البعض. حدد من العلاقات الاجتماعية بحسب عدد اللايكات وبحسب عدد الكومنتات اللي بتكون موجودة بالتويتر أو بتكون موجودة على الفيسبوك. فإذا حطت لي لايك، لنفترض أن ناخذ مثل، معناها شخص مهتم فيها. مثلا لما مثلا ما تكتب كومنت أو إنها لايك شيز ignoring يعني، أو إنها بتتجاهل. فعمل مشاكل اجتماعية بصراحة نحن مش بحاجة إلها بالوقت الحالي. بالإضافة أنه جعل حياة الناس مباحة للجميع. طبعا هذا يخضع لاختيار الشخص، هو بيحدد هل هو بده يكون حياته مفتوحة، كتاب مفتوح للجميع، أو أنه يحتفظ بالخصوصية بحياته. التباعد بالعلاقات الاجتماعية وصارت التهنئة أو الكلام مقتصر على واتساب، رسالة بواتساب مسج أو فويس نوت. بعد كتير العالم، بالرغم انه احنا كلياتنا بنعيش في عالم صغير اللي هو عالم في السوشيال ميديا، لكن كعلاقات اجتماعية احنا تعودنا عليها منذ الصغر. غيرت شكل العلاقات الاجتماعية بطريقة انا لا الاقيها انها جيدة أو إنها فعالة. لكن للأسف إحنا بنحاول إنه قدر المستطاع لا نقع فريسة للتكنولوجيا، بالرغم إنه أنا بعتبرها ما زلت إنها تكنولوجيا جيدة أوصلتنا للعالم الخارجي. أصبح العالم الخارجي عبارة عن عالم صغير جدا تمتلكه بين يديك عن طريق جهاز. لكن المشكلة اللي احنا بنواجهها اللي هي المشاكل اللي أفرزها استخدام المبالغ فيه لوسائل التواصل الاجتماعي. هاي لازم ينوضع لها ضوابط، قوانين في داخل البيت وفي المحيط الخارجي لكي نتجاوز محنة المصاعب اللي بنواجهها كل يوم مع أفراد المجتمع الواحد، سواء المجتمع الكبير المحيط اللي احنا عايشين فيه أو المجتمع الصغير في داخل البيت الواحد أو العلاقات الاجتماعية بين الأقارب الأصدقاء والأفراد.
شكرا جزيلا أستاذة مها. Thank you very much. She touched upon the real core of the problem that it's people started to use social media world as virtual world instead of the real world, which has actually contributed to decreasing the social interaction, especially in our Muslim world and Middle East. We used to be a very sociable society. Now, by the excess use of social media, we have come to become a very personalized, adopting a very personalized attitude. And moreover, the social media has, as she said, contributed to violation of our privacy, which is again, in the context of our very conservative societies, it is becoming open, more open to other people's interference. This is definitely one of the negative aspects, and which for us, specifically in the region, we need to look into it through very wise and very well-studied strategies. Dr. Muwaffa is one of, he is by definition a professor of informatics, and he has a lot of experience and research in the area of social media. Dr. Muwaffa, on basis of what we have this morning on the different profiles of the social media, be it globally or in the three countries which we have had synopsis of their summaries on the social media, although it is among a limited number of people. As a researcher and somebody who is specialized in social media, what could you advise as a technical personnel in the issue to limit its use to suit our society?
Assalamu alaikum. I think that's a very difficult question to ask in terms of the technical issues, because you can't stop people from using social media. My daughter's 3 years old, and she's addicted to this YouTube channel. And you can't, if you take it away or you try to give her alternative, she starts crying. She starts, how can you stop them from doing that? And I think a lot of it comes from home, and us as parents, or that's our biggest. We're looking at youth. We're the parents. I have fourth child on the way, and we should be the examples, showing our children how to use social media, educate them, because social media is an empowering tool. It's very powerful, but if you don't educate people how to use this powerful tool, they can use it in the wrong way. And us as parents, myself, me and my wife were sitting down with the kids, and she's on WhatsApp, and my kids is watching this, and we have to change this dynamic. So some people, what they're doing, for example, if they're in a meeting, like today, so some people, they turn their phones off. You know what? I'm going to turn my phone off for an hour. I'm going to stop using the phone on Saturdays for the day. And watch the difference. Wallahi, just the other day, I forgot my phone was off. I was traveling. I couldn't find the battery. And I'm thinking, well, I can't find my phone. I need to do something. And you know what? I was relieved that I'm not getting messages all the time. And at the same time, I worry, what if I miss something? And we need really to think, if something is really important, somebody will find you. You don't have to. What did people do before the telephone? What did people do before the cell phone? what did people do? They still found each other, they still interacted, they still did things. So we need, I think it's more from a technical, more from a behavioral aspect that we need to think about and educate our youth and educate ourselves on how to use this powerful tool in the right way, the right manner. Because one fear, and we're talking with Mehmet about this, al-ghazw al-fikri, and from outside that we get, if you're looking, we're talking about this, and he's telling me, what if our youth are looking at other countries and other places, and they make the Muslims, most of the Muslims look bad, or negative attitudes and stereotypes to who we are, and so forth. And our children are going to see this. How is it going to impact them psychologically as well? So we really need to work and give them a venue. We can't stop them. If you stop them, they're going to do something worse. So you have to kind of direct them and educate them on what is appropriate and what is not appropriate. And as I said, the research that we were doing as an academic, as a research, what's happening in the Arab world, al-thaqafa, how to use the internet and social media is not there. People use it for everything, especially in places of war, especially in places where there's a lot of problems. People are talking, they're sharing things that shouldn't be shared, they're talking about things that shouldn't be shared, and they're asking for things that shouldn't be asked for under normal circumstances. But because of desperation and what's happening, they're doing that. So I think we have a lot of challenges going forward. And by the way, all the stuff that we're saying, that we're talking about, they're only anecdotal evidence. We don't have any evidence saying that this actually works and this doesn't work, how the people feel. Is it having an impact, positive or negative? We think it's having an impact, but we really don't know. We need more studies, more research to do and find out what are the impact of social media, the real impacts of social media on Arab or Muslim youth as well. And I think that's the biggest challenge that we need. We need to talk about evidence. We will find the evidence so we can find out some real solutions. And until then, I think we need some time. And I think we really should start from home at the moment till we know what needs to be done in the correct manner for the future. Thank you.
Thank you very much. I would like to give a chance for the floor. Some people who would like to chip in. As highlighted by the different presenters and now the panel, that mostly we feel sometimes as victims, other times as actors in the use and abuse of social media. How do you think that we can maximize the positive effect without jeopardizing our, our teens' privacy or freedom to get into action with the world? Anybody who has any idea about how we can maximize the positive use of social media? A lady approached me a minute ago that she would like to, at least she has some recommendations. Anyhow, whenever you feel that you would like to make a recommendation, please, President Jamil, may you kindly give him the mic?
Hi, my name is Shaukat. I loosely handle social media also at different organizations. I think one of the best ways is to identify what are the negative impacts first. Because when you don't know what are the negative impacts, you will not know what are the positive changes you can make out from the social media. And I have seen like social media, as one of our panelists was discussing about, like we don't have the evidence, like some concrete research, like what is the impact of the social media on our youth or whosoever uses it. But, as you say, because at the time when social media started, it was just, a meeting point. You just network you make new friends and all. But if you see now, it's completely different. It's now you have social media campaigns, political personalities are using it as a. Now you have so many examples from different countries where the presidents and prime ministers are, selected based on their social media presence. So now it has completely changed. And how will you analyze those things actually? If you do the research on the social media, like the impacts, so we don't know the future of the social media. Maybe tomorrow it's used for some other purpose actually. So I think it's better to, make it more regulated. In the sense like you use it only for the development purposes and not for the negative things. I mean, there's a need of more regulation in terms of the monitoring of the social media, and there should be a team which monitors, completely, like if there's any negative campaign starting and all, they should not be, reflected in the social media. Thank you.
Thank you very much. And I would like just to give the floor back to Michelle. As a representative of youth in an organization like King Saud University for Science and Technology, for those who don't know it, this is a newly created global university in Jeddah. So,
King Abdullah.
Yeah. And it is a cosmopolitan institution which brings people from all over the world. Could you please tell us on your proposals or suggestions for better use of social media?
Yeah, I would say the particular case of the university is quite intricate. You have on one side, of course, many students from Saudi Arabia who are in their home country, and for them using social media for communication fills, I would say, one certain purpose. Then you have the international students who are maybe away from their homes, and for them, I would say, being on social media and actively communicating with family back home fulfills another purpose. I would say that relating to your question about acting or being victims, it is about personal empowerment, and I would say that there is no maybe general rule that even students at our university can follow. I think again each personal case is so specific and so different. I think what is important, however, is to have some influencers, and in the talk this morning we heard that, well, the Ministry of Health here in the Kingdom of Saudi Arabia is trying to promote some of the content using influencers. I believe in university campuses as well, having some students and some youth acting as positive influencers, that can contribute to, I would say, relieving some of the negative effects of social media. So that will be something that can be considered and thought about. So having these groups, of course, on Facebook or WhatsApp, where you can share content with your friends and influence, I would say, them in a positive way. You share positive content, and also sometimes you just say, well, let's just leave our smartphones at home and let's go for a trip outside the campus or go to Jeddah. So yeah, this is just one of the aspects I will think about, and from my experience here, this is what I felt worked for me and for some of my colleagues.
No doubt, thank you very much. No doubt that the boom in the use of social media has come or has happened on the account of the traditional media. Journalism, or traditional journalists, because now we have also social media journalists. So for Ms. Maha, as a journalist, how do you foresee your job as a potential supporter for better use or rational use of social media?
أكيد.
كيف ترين الصحافة كوسيلة لدعم استعمال المرشد للسوشيال ميديا؟
السوشيال ميديا لها دور فعال في الصحافة، والصحافة ليس العكس، مش الصحافة لها دور فعال في السوشيال ميديا. لإيصال فكرة بطريقة أسرع، فالسوشيال ميديا هي أسرع طريقة لإيصال مقال. يعني بما أني أستخدم أنا السوشيال ميديا، أنا مقننة باستخدام السوشيال ميديا، أنا ليس لدي كل الابليكيشنز. I don't download all the applications. لحتى ما أكون ضحية للتكنولوجيا اللي رح تستنزف وقتي وجهدي طوال الوقت. أنا أستخدم التكنولوجيا لتسيير أعمالي. الجهاز الذي أحمله لديه كل التولز لأكتب، لأقرأ، لأتابع، لأحرر، لأدقق، لأصحح، لأراسل، وليس لأراقب الناس، وليس لأتطفل على الناس. فأنا أستخدم السوشيال ميديا أو التكنولوجيا بطريقة تجعلها أسرع بالنسبة لي لإنجاز العمل، وليس لإضاعة الوقت، لأنه الفراغ اللي بيعيشه المجتمع الحالي أكثر مجتمع النساء عندهم الفراغ، فالفراغ بيستخدموه بطريقة جدا سلبية بمراقبة الناس في السوشيال ميديا. هذا اللي تحدثت عنه مسبقا، اللي هو أفرز الفراغ، والسوشيال ميديا أفرغ مشاكل وآفات اجتماعية جدا سلبية أثرت على علاقات الناس بطريقة جدا كبيرة. فكوني صحفية وكوني أكتب وكوني أحرر، السوشيال ميديا ساعدتني بشكل كبير لسرعة نشر الخبر، إيصاله لأكبر شريحة من العالم، بالذات إذا كنت أحمل قضية وأتكلم عن قضية معينة أحب هذه القضية أن تصل لأكبر عدد من الناس. فالسوشيال ميديا ساعدتني. خليني أتحدث عن تجربة حاليا أنا أعيشها. تويتر بشكل خاص ساعدني أنه أنشر قضية الأسرى المضربين عن الطعام في فلسطين المحتلة. طبعا استخدامي لتويتر هنا، أنا أشكر تويتر أنه أتاح لي فرصة الوصول لبلدان العالم بشكل عام، وبالأخص بعض البلدان العربية والبلدان الغربية اللي اشتغلوا معنا على هاشتاج ملح ومي إضراب الكرامة. هذا الشيء ساعدنا أنه نوصل صوت الأسرى الذي هم محتجزين وراء الجدران. طبعا هون السوشيال ميديا لعبت دور كبير فعال وإيجابي في أني أنا أطرح قضية وتوصل والعالم يعرف عنها. طبعا بما يخص المشاكل الاجتماعية أنا تحدثت عنها، اللي هي استخدام السوشيال ميديا بطريقة تجعلنا نكون رهينة وفريسة للتقدم التكنولوجي اللي أنا تحدثت عنه، اللي هو السلاح ذو حدين، السلاح السلبي وليس السلاح الإيجابي.
بارك الله فيك. Thank you very much. Our last comment would be to summarize our inputs from the morning up to now on recommendations for the concern, the Organization of Islamic Cooperation as our political umbrella guiding the Islamic world, for the Islamic Development Bank, which is an affiliate of OIC, and as a financial global institution which is catering, among others, for the health of the people in the Islamic world, for our member countries, which has each has got its own political guidelines, as well as for our families. So we would like to have your suggestions or recommendations on specific recommendations which could guide our vision towards better use of social media.
Thank you very much, Dr. Salam. Let me start with this thing that we are living through interesting times. This is a times when the digital revolution has altogether changed the societies. How do we approach the information? And if I compare it with the invention of the printing press in 15th century, it will not be too much off the mark. In the last 40 years, now there are more mobile users than the total population of the world. Growing at a rate of 21%, we will have all the world population will be using on the social media. Whether we like it or not, the social media is here. It's going to stay. The conversation on the social media is going to continue with or without us. The beauty of this new revolution is that it has already transcended the geographical boundaries. Now it is difficult for one nation state to take and implement the decisions. The decision has to be taken by the governments. As an intergovernmental organization of Islamic Cooperation has put together 57 member states on a platform where they can share their experiences and best practices to learn from each other. We have adopted a three-pronged approach to tackle and foresee the future. How can we react to the growing emergence of popularity of the social media, internet, and the mobile phone use, and specifically to use it for the health-related issues. The three-pronged approach contains basically to make the cyberspace safe. Secondly, how to provide credible information which the member states and the individuals can use. And thirdly, how to reach out to the common man in the 57 member states. If you allow me, I can just briefly touch upon the three-pronged strategy. In 2008, OIC has constituted an affiliated institution by the name of Computer Emergency Response Team. The basic purpose of Computer Emergency Response Team is to prevent and reduce cybercrimes, harmonize cybersecurity policies, laws and regulations within the member states. To date, there are 28 members of the OIC CERT, and we look forward to strengthen the role of the OIC CERT in the coming days so that the OIC should have a common policy regarding the cyberbullying, cybercrimes, and how to strengthen the capabilities of the member states. In this regard, OIC is not, as I mentioned, is not a homogenized group. It contains some member states which are behind the curve of learning in the internet and the social media users. Some countries are well ahead and are leading the rest of the countries. So we trying to encourage those member states which are ahead in that curve to share the best practices with the OIC member states and to formalize and harmonize a comprehensive, coordinated OIC position on cybersecurity. Secondly, to provide the credible information, because the information on the social media is available 24/7. A lot of misconceptions have been put forward, and the member states have to come forward with the information which is credible and appropriately responded to. We have established in 2014 an Islamic advisory group constituting OIC, IDB, Islamic Fiqh Academy, and Al-Azhar University. The basic mandate of the Islamic Advisory Group was to prepare information regarding polio vaccination in the polio-affected countries. And we have seen a remarkable results in the three polio-affected countries in Afghanistan, Pakistan, and Somalia. After the success of IAG in the polio vaccination campaign, we have increased the mandate, expanded the mandate of IAG in 2016 to increase the topics of maternal, newborn, and child health as well. Hopefully, once we increase the mandate and work on with the Islamic Fiqh Academy and Al-Azhar University to provide the information on health-related issues in light of the Islamic teachings, that will be a resource center for the member states to use them on the social media according to their needs. Thirdly, about the communication and strategy, in the 5th Islamic Conference of Health Ministers held in Turkey in 2015, the health ministers had deliberated upon this issue, how to make a coordinated communication strategy to reach out to the people. There are different methods and mechanisms to reach out to the common people. We are now in the process of establishing an OIC health portal, where the information about the health status, about the member states will be there. That OIC health portal will be integrating the social media like Twitter, Facebook, Instagram, as well as just texting, to provide information about the health issues in light of the Islamic teachings. At the end of the day, what we can say is that this digital revolution is going to stay. It is on us how to develop an Islamic narrative, how to change the course of the discussion on the social media, and to put forward our point of view so that we can tell the truth, the right way of doing and using the media. Thank you very much.
Mr. Irfan. Ms. Maha, could you please chip in with some kind of specific recommendations from your perspective which could enhance our better use and effective use for social media?
أنا ألخص الريكومنديشن بكلمة واحدة وهي المراقبة. فقد الشيء لا يعطيه إذا كان الأم والأب في البيت هم أنفسهم مثال بالاستخدام المدمن للسوشيال ميديا، فلن تكون هناك أي توصيات على الأبناء، فرح يكونوا نسخة من الأم والأب. فلذلك لازم يكون في وعي كافي من الأم والأب في استخدام التكنولوجيا ساعات معينة، عمل خطط لقضاء وقت أكبر مع الأسرة ومع العائلة بالتحدث بالنقاش. في الكتابة أنا أحبذ الكتابة، لا أحبذ الكتابة على السمارت بوردز، أحبذ الكتابة بالقلم والورقة لأنها ترسخ بالعقل أكثر. فكثرة استخدام السوشيال ميديا أضاعت من عقولنا الحروف ومن أفواهنا الكلام. صرنا بنقضي وقت صامت مع أنفسنا بعيدا عن التفاعل الاجتماعي في داخل الأسرة الواحدة. أنا أوصي الآباء وليس لي أي توصية على الأبناء، فالحل يبدأ من الكبار والعلاج يبدأ من الكبار. تحديد الأوقات لاستخدام السوشيال ميديا يحدده الأم والأب، حتى لو كان كل أعمالهم وأشغالهم بالتكنولوجيا، يعني أقل شيء لازم لا يظهروا هذا الإدمان في استخدام السوشيال ميديا أمام الأبناء. يخصصوا أوقات كبيرة يقضوها مع الأبناء. دائما نعطي الأبناء حتى لو كانوا هم مثلا مدمنين على السوشيال ميديا من الأصدقاء، لأنه نحن نعيش في مجتمع صغير تكثر فيه العدوى بالصفات السلبية أكثر من الصفات الحسنة. فلو أنا كنت عاملة تقنين في البيت فممكن في مجتمع الأصدقاء ومجتمع العلاقات الخارجية يساهم في تدمير ما أنا أبنيه في داخل بيتي. فلذلك يجب أن نعطي نصائح إرشادية دائما للأبناء عن مدار استخدام ساعات طويلة أمام السوشيال ميديا، أضرارها على الصحة النفسية والصحة الجسدية. فالمنطلق لازم أن يبدأ فيه من الأم والأب، من الكبار في داخل البيت الواحد. بالإضافة في المدرسة يجب أن تكون هناك دائما حصص توعية وإرشادية في المدارس للحد من انتشار إدمان. أنا لن أقول السوشيال ميديا لأنها انتشرت وموضوع خالص، بس الحد من الإدمان من استخدام وسائل التواصل الاجتماعي والأخطاء الذي يرتكبها الصغار بنقل أخبارهم للعالم، وإنهم يكونوا كتاب مفتوح أمام العالم. حتى هذا يؤدي لمشاكل اجتماعية بما يخص السرقات. لما أي حد بالسوشيال ميديا يعرف عن نفسه هو بالمكان الفلان أو بالمكان الفلان، فهو يعطي فرصة للمتربصين له يعرفوا مكان تواجده. وهي صارت كتير في مجتمعنا، سواء بمجتمعنا العربي أو بالعالم بشكل عام. فالمراقبة الريكومنديشن الوحيدة اللي هي المراقبة.
Okay, thank you very much, Mr. Michel. I would like to give you the chance to give us some recommendations as regards to the youth.
Yeah, I would say that a very important aspect is to categorize different segments also within the youth group. Again, you have students who might travel abroad, leave their home countries, encounter totally different culture, lifestyle, and they will use then social media maybe to keep in touch with their homes, their countries, their cultures, and so on. You have other students who don't travel maybe as much. They are still in their homes, and maybe these are students to which such awareness campaigns early on, when they are children, during teenage years, it can have a big impact. But again, I think different segments have to be addressed differently, and I particularly think that such awareness campaigns should also address students in their university years. as part of orientation. Usually, when you enter university, you have an academic orientation, you have a cultural orientation. I'm talking about here international campuses. I believe that an orientation on the use of social media or just raising awareness will be something very valuable. So I believe universities and educational institutions that house students on their campuses should also think about such awareness campaigns. And last but not least, I believe that among the youth population, influencers and using positive influencers will have a big impact. This is just talking from my personal experience and that of our student groups maybe.
Thank you very much. The last deliberation is expected from people who use or create, the creators, the actors. Dr. Muafa, what do you see the effective way for better use of social media?
You know, I'm sorry, I'm going to comment a little bit on the information that the speakers were saying. Anyone watch the movie Spider-Man? It said, with great power comes what? Great responsibilities. And with great power, our youth, they're disenfranchised, disempowered. Now they have this powerful tool. And they're going online and they're sharing information, but they don't have the education and the right ways to do it. And for the Islamic Development Bank, my biggest worry, or we don't have the evidence to know where to invest or what to do, in which we can have a list of 1,000 problems, 100 problems as a result of social media. What are the top 3 or 4 or 5? Nobody can tell us exactly what, in which region, in which area, in which countries, what are the 3, 4, 5 main problems they're having with the use of social media and the impact on that youth, both negative and positive. So my recommendations is we need more evidence, more to understand the problems and to attack or to help or to support the 3, 4, 5 main issues that we're having to be targeted. And when we know that, we know that we can create interventions. Well, you know, we're having 3, 4 problems in the Arab world, the Muslim world. In these countries, they have this problem. In these countries, they have this. How can we collaborate? How can we do more interventions, more as an academic, as more research to help our youth use social media in the proper way and know which problems they're having so we can target those specific issues that they have, because the problems are endless and they can be many, there are so many. Let's be more targeted, more focused, and more evidence-based. And when we do that, I think this is we would have better results and in helping and making a difference. Thank you. So.
Thank you very much. At the end of this very interesting session, I would like to call upon Dr. Alfaba to give us concluding remarks and close the session.
Okay, thank you very much, Dr. Bashir. Thank you very much, dear panelists and dear attendees. And I think this is a great session and very resourceful recommendations that have been provided here. I'm sure most of you know how the banks operate. We receive projects from member countries and we support the countries based on the requests they make. However, taking one of your recommendations, which is to have more evidence, and I think one way to do that is to leverage on the projects that have been submitted by the countries to support health projects. We can try to see how we can include some sort of formative assessment into within those projects to bring people, experts to try to identify or to conduct those evidence-based research and to allow for decision-making to tackle some of the issues. And I think most of the colleagues here have contact with the IDB governors who are here currently. The message will be conveyed and I'm sure if the countries come to the bank requesting support, I'm sure we will consider the support. We really thank OIC for the great collaboration, Cedric here and all the key stakeholders who attended this meeting. Thank you very much.